I'll tell you, we are
Casper, you could be on the
live.
internet.
All right, very cool.
15 minutes of fame.
So tell me if you guys can see me on the screen and tell me what you see.
You're in a circle.
All right, that's where I
Chapter
want to be.
1, Introduction to Central Service.
That's where I want to be. Okay, very cool. Let me get situated here.
Well,
First
I
of
see
all,
why you selected this platform.
uh huh. First of all, I don't want anybody worrying about this course and getting through it. Um, we're not training to be brain surgeons here, although this work is critically important. It's not rocket science. Rocket science is hard. This is just going to be new information. Here we go. Welcome to chapter 1. This is the introduction to central service. Let me ask you guys, each of you, to go ahead and mute because I am getting some feedback. So if you haven't muted your microphone, please do so. So when we cover each chapter, the first thing we'll do is we'll look at what we call our learning objectives, what we hope to get out of this particular lecture. So we'll start by going over the learning objectives for the chapter. What's our goal? Number one, in this chapter, explain the importance of the central service department with an emphasis on the service provided and the role of central service in quality patient care. Review the workflow process in an effectively organized central service department. Identify basic knowledge and skills required for effective central service technicians, which is exactly what you guys will be once we get done with this 3-month course. Define job responsibilities of central service technicians. And number 5, discuss the role of education and training in the field of central service. So the majority of medical procedures that are done all over the world, and there are hundreds of thousands of procedures done every day all over the world, require the use of instruments and or equipment. Some of these items are used once and thrown away. We call those items disposable items, and we use lots of disposable items in the operating room. Others are reused multiple times. Reusable items must be thoroughly cleaned, inspected, disinfected, or sterilized before they can be used to treat other patients. 95% of the instruments used in surgery are reusable. They're made out of stainless steel or titanium. They have to be thoroughly cleaned, inspected, disinfected, or sterilized. It just kind of depends. We'll go through that later down the road before they can be used to treat other patients. The Central Service Department, or CS department, in a healthcare facility performs these important tasks. Medical technology, like computer technology, like IT, is always advancing. You always associate healthcare with innovation, advancing technology, change. Devices used in the operating room have changed over the years. As these devices become more complex, more complicated, smaller, so do the methods that are required to reprocess them. The methods become even more complicated. One major, relatively recent change in the operating room theater, the world of sterile processing, was the switch from open surgery to what is called MIS, or minimally invasive surgery. Instruments got much smaller, the wounds got much smaller, which means less trauma to the patient. They can go home much sooner. Win-win for everybody, except the people who are taking care of these critically important instruments. They became smaller and more difficult to take care of. Minimally invasive surgery provides many benefits: shortened hospital stays, like I just mentioned, for the patient, smaller incisions, which means less trauma, shorter recovery times. Back in the day, you'd go into the hospital. If you needed your gallbladder removed, your incision would be 6 to 8 inches long, and you might be in the hospital for 2 weeks. Today, you can go into the hospital and have your gallbladder removed in a minimally invasive way and be home the following day. So lots of advancements in the field of instrumentation. So whenever you hear the term MIS, or minimally invasive, it just represents the least traumatic approach as it relates to surgery, to doing surgery. Smaller incisions, less trauma, less complications for the patient. So this is a definition that you can look at in your text of what a minimally invasive procedure is. And I did send you guys a copy of the textbook. I encourage you, when you get time, to read the chapters ahead of the lectures, so that when we start doing this, it sort of, flows. Minimally invasive procedures also introduce, like I said before, more complicated instruments that are more difficult to clean. These instruments require complex processing protocols. Some people may think that in this particular department in a hospital, they just washing dishes. They are glorified dishwashers. Well, this couldn't be anything further from the truth. Medical technology will continue to change. The medical field is one of constant innovation, and CS technicians will be required to keep up with these advances. Just like the whole world around us, everything is moving to AI and integration when it comes to electronics and computerization. Healthcare is absolutely no exception. Today's sophisticated medical devices, all of the instruments and equipment used to take care of patients, require more complex handling and processing, which has resulted in many changes in the field of sterile processing and for central service technicians. So what you're looking at here on the screen, these two pictures, on one of the graphics where you see the two surgeons seated, they are actually operating a surgical robot that is operating on the patient. The other picture to the right are the actual instruments that are being used in this minimally invasive procedure. So what's great about this, again, is all of the things I just talked about: less trauma, so on and so forth. But you could have a doctor in Scotland sitting at this terminal working on a patient in Los Angeles. As long as they have a good, solid internet connection, we've come a very long way. Central service. So the field that we're talking about, the field in the profession that takes care of surgical instruments and supplies, the department that manages all of the activities that are very important for surgeries to take place. We support the operating room. That place in the hospital is typically referred to as the central service department, central service. It means that the services that are provided are centralized. They come out of one place. So the reprocessing activities, taking care of the instruments, those 95% of surgical instruments that are reused, that need to be properly cleaned, sterilized, so on and so forth, those services are centralized in one department under one system and one set of standards. We don't have a situation where every department that uses instruments are taking care of their own instruments. These services are centrally located and provided for. I'm going to do a quick check to make sure everything is still good. You guys can hear me okay and see me okay. Unmute your mics and just let me know that we're still good to go.
Still good to go. Think we lost a member temporarily.
Uh-oh. Who'd we lose?
Shalita.
Okay. All right. Hopefully she'll be back. All right. Here we go.
I have a question.
Absolutely.
Is this a cameras on class?
No, absolutely not. Listen,
Okay,
this
cool.
is completely up to you. No.
Okay, cool. I'm just
Your
gonna.
camera could be on, it could be off. It doesn't matter.
All right, cool.
Yeah. Okay, that's completely up to you. All right. So central service is that department in the hospital that does this critically important work. So this type of setup, centralized management, provides maximum utilization of both human and material resources. Having these activities centralized eliminates duplication of equipment, utilities, space, and personnel. Centralized, right? When services are centralized, when the most effective processing equipment is used, and when a better educated and prepared workforce is available, staff can process a greater volume of material in less time and meet those serious demands from the operating room. So that's the central part. Central service, central services, right? The service part is what central service is all about, providing items essential for proper treatment when they are needed. Central service personnel assist in direct patient care. We assist direct patient care providers, people who are in the brain, people who are working on fetuses. We're providing them with what they need to do their work. We're taking care of the instruments that are going into somebody's brain. Central service personnel assist direct patient care providers with medical, surgical supplies, instruments, and equipment. Those are our customers. Central service personnel are an integral part of quality patient care. Hospitals are all about teamwork. Nobody is an island. The work that central sterile technicians do are critically important to taking care of patients. So remember, the overarching name, the professional name given to these departments in a hospital is central services, right? If you say CS or central service, everybody in a hospital knows what you're talking about. But these names may vary regionally or even locally. It just sort of depends on what your specific department's focus is. We're not going to overcomplicate this. So central service is the accepted name for this department in many healthcare facilities. This is true. In some facilities, central service is changed, the name is changed to reflect the scope of services or other needs. Not all hospitals are the same. not all healthcare facilities are the same. Not all central service departments provide the same services to their customers. Regardless of departments served or services provided, the services provided are always guided by the same principles and standards of operation. So, central services is the accepted name, but you'll see names like sterile processing, central sterile supply, central processing, sterile processing and distribution. Again, it really depends on how that healthcare facility is set up. The central,
I have a
yeah, go
question.
ahead. Mhm.
But all of those things, those are all the same exact thing. So like no matter what hospital you go to, it's going to be called something different, but it's the same job.
Yeah.
Okay.
So most hospitals will probably use the term or the name central services, but there will be some hospitals that'll call it sterile processing, right?
Okay, got it.
But they're essentially doing the same
The same
function.
thing. Okay.
Yeah. So let me give you another example because I don't remember if this example is in the slides or not. So some central service departments may process instrumentation for just the operating room, right? So some
Okay.
hospitals are set up that way.
Okay.
And then they have, so that'll be an SPD, a sterile processing department. And they may have in conjunction to that a central sterile department that takes care of the other clinics and other areas of the hospital that require the same or similar services. So they have one area pretty much dedicated to taking care of the OR.
Okay.
So you'll probably see that kind of setup in facilities that are much larger,
Okay.
right? So the CS department is the central location for delivery of soiled medical devices and the distribution of clean and sterile items. If the items were used on patients and their instruments or supplies, instruments or equipment, and they're now soiled, there's one collection point in the hospital. They're going to come to the sterile processing or central supply department. The central supply department is also the distribution area for clean and sterile items. Everything is here, that's clean and sterile, and then it gets distributed to where it needs to go. The central service department is the central location for delivery of soiled medical devices and the distribution of clean, sterile items. So soiled refers to dirty. These
I have a
items.
question, sir.
Yes.
So what's the difference between like the soiled linens and like housekeeping? Like, so do they process all of the and anything surgical, and then there's another department that just does the general washing and cleaning of like hospital gowns and scrubs, or does all of that go through central service?
Yeah, two completely separate functions. If you think of central service or sterile processing as taking care of surgical instrumentation and equipment for surgery, right? So yes, there is a clear distinction. There's typically environmental services that would take care of other kinds of cleaning the rooms and other objects. There's typically a laundry service department that takes care of linens and that sort of thing. So
when they
CS.
Sorry. So when they say soiled or dirty items, they're not referring to clothes.
Well, they could be. Again, context is everything, right?
Okay.
So you would need a little bit more specificity because when you use the term soiled, all you're saying is that the item's dirty, right? So you could have dirty instruments, you could have dirty linen. So it just sort of depends. The term soiled just means it's dirty. In our context, we're talking about instrumentation, surgical instrumentation or equipment. So that's sort of the dividing line. We don't do linens. We don't do floors. You know what I mean? So it's strictly taking care of items that are required for surgical procedures.
Okay, this might be beating a dead horse, but
Uh-huh.
so what about the surgical rooms? There's that like some special people sanitizing the floors and the spaces in there to keep the room what's that term?
Clean.
Surgery that well beyond clean, but
Yeah,
surgery ready.
Yeah. So the rooms, it's clean. The correct term is clean because you can't really sterilize those kinds of areas, but they can be disinfected. You're absolutely right. People who take care of disinfecting and cleaning OR rooms are environmental services people who are specifically trained to do that task. So there are people who work for the EVS or Environmental Services Department in the hospital that does that task. When they are assigned to the operating room, they have additional training, so they know the right kinds of chemicals to use, so on and so forth. Yeah. Does that make sense? So when you think of central services or sterile processing, you think surgical instruments, surgical equipment, and supplies, not floors, not walls, not mops, not rags.
Okay, I get it.
Critically important that distinction is very clear. We take care of things that surgeons are using to work on patients. It would be as if
that's like you take care of, like, I know you said this is not like a dishwasher position, but you're essentially doing the dishes like in a kitchen.
Well, that's blasphemous. Don't you roll up on no professionally trained central service technician. So basically you wash the dishes, huh?
No. Dot it up with a splash of bleach. Clean the instruments.
So the distinction here is surgery, instrumentation, surgical instruments, and equipment used to perform said surgeries, right? We have cleaning people, that's a whole different department. There are people that take care of laundry, that's a whole different department. We work arm in arm, hand in hand with the surgery department or the operating room department. Surgeons are too busy to take care of their own instrumentation and supplies, so we do that for them. Nurses focus on the actual patient and taking care of the patient. All of it is equally important. We focus, central service technicians focus on managing and taking care of the instruments, equipment, and supplies for surgical procedures. We're not cleaning, we don't mop. It's not that kind of party. Soiled or dirty items must be always isolated from clean items. And this is, of course, something that we all know and understand, but it's a critically important concept to really retain. It's really at the core of what this profession is about, understanding what is dirty, what is sterile, what is clean. And those are all three different things, and they never should intermingle. That's called, or there could be cross-contamination. And again, we'll talk about that more as we go through this course. So soiled or dirty items must always be isolated from clean items. Makes sense, right? A one-way flow of soiled materials, dirty items, used items, from the soiled area to processing and storage areas must be maintained. It's really important that we don't have cross-contamination. We're in a hospital, a lot of sick people. Obviously, people's immune systems are compromised. They're in very delicate states. The last thing we want to do is add to that whole mix by distributing unknowingly, unwittingly bacteria everywhere. So there are very strict protocols as it relates to the movement and flow of dirty things and clean things. We never want the two to meet, right? That should be very clearly understood. And we'll continue to reinforce that as we go along. So this one-way flow that we're talking about here, I want you to conceptualize it. Dirty items are used. There's one route that they can take from the operating room to the centrally located area, the decontamination area, where they're going to be processed, right? We can't park them. Oh, I'm gonna hold these over here for a minute. I'll take these over there and I'm gonna get it later. There's strict protocols. And the whole idea is to prevent cross-contamination. We don't know what bugs, we don't know what that patient had, and we don't want to cross-contaminate people or other inanimate objects with our soiled items. So it's critically important that we utilize a one-way flow for these materials. We're going to take the dirty stuff from the operating room directly to where it needs to go, which typically involves some sort of a dumb elevator, a dirty elevator. It's designated as such. The items go into that elevator and they go directly to the central service area in an area called the decontamination area. But I'm getting ahead of myself. So a one-way flow is really important, and we'll be coming back to that one-way flow. So this isolation, this separation that I'm talking about as it relates to the one-way flow and keeping soiled and clean separate, again, decreases the chances of cross-contamination. And what is cross-contamination? It's the spreading of pathogens or microorganisms that could be infectious to either inanimate objects, doorknobs, chairs, what have you, and then other people touch it, so on and so forth, and now they have something, right? So the idea is to decrease cross-contamination. We appreciate and understand that the soiled items could in fact be infectious. We treat everything as such. And so again, there's specific protocols that we need to follow. The idea is to decrease the chances of cross-contamination. So here's a basic central service workflow. So the items leave the OR. Mrs. Johnson just had her brain aneurysm fixed. Those brain instruments are going to be properly prepared by the operating room staff, and they're going to be sent down to the decontamination area in the central service department, following a very strict and deliberate protocol. Goes to the decontamination room, which is completely separate from the rest of the department. It's separated by walls, windows, etc., right? Again, to decrease the chances of cross-contamination. So from the decontamination area, okay, one-way flow now, after things are cleaned, they're then moved on to what we call the prep and pack area, the preparation, packaging, and sterilization area, only after they have been cleaned. So they go from the decontamination area, they're cleaned up, they go to the prep and pack and sterilization area in a one-way flow. Then they go to sterile storage, where the items are stored before they're used again. A one-way linear flow to prevent cross-contamination. To facilitate this one-way flow that's critically important to decreasing and preventing the chances of cross-contamination, physical barriers or walls are used to segregate the functional areas of the central sterile or central service department. So if you look at this picture that I have here, what you're looking at there is what we call a washer decontaminator. And Shamara, don't you say dishwasher. So it's a washer decontaminator. On the other side of this washer, and these things, if you just imagine, kind of like a car wash situation. So the instruments that he's about to pull out on this little trolley thing, this is the clean side. The dirty instruments are loaded on the dirty side, which is on the opposite side of this wall, right? That's the decontamination area. Typically, there's a decontamination or dirty elevator on that side. Stuff comes down from the OR, they get sorted, and they get put through these machines.
I have a question.
Only when they're cleaned are they automatically queued into the clean area. Go ahead, Kima.
Should this person not have on some gloves to maintain the cleanliness of these instruments? They just about to grab it with their bare hands. They could have just picked their nose.
No, the answer is no. Yeah, good observation, but the answer is no. Remember, there's strict protocols. He is on the clean side. So what has happened prior to these instruments being released into his area is a lot. Lots of chemicals have been applied by this point. A lot of heat has been applied. A lot of ultrasonic cleaning, which we'll get into, brushing, so on and so forth. So by the time it gets to the clean side, they should be ready to be handled, right? That's why we have things completely separated. That's why we use these industrial cleaning equipment to render these items clean. So to facilitate this one-way flow that we're talking about, to prevent cross-contamination, we have physical barriers, walls, which are used to segregate the functional areas. So we talked about the decontamination area. That's the area where all of the soiled items are going to go to and sorted and cleaned and disinfected, right? Then we have the prep and pack area where he is. He is now receiving these instruments that are ready to be inspected, that are ready to be packaged, that are ready to be sterilized, that are ready to be inspected, right? And then we have sterilization and sterile storage. So after the items are inspected, they're packaged, and we'll talk about all that. They're sterilized, and then they're stored in what we call sterile storage areas before they're used again. So decontamination, what is it? You need to know this. Decontamination is the physical or chemical process that renders an inanimate object, like surgical instruments, safe for further handling, which is why, my dear sister, he can touch those instruments that have been decontaminated. Hopefully,
I still don't agree because
thoroughly decontaminated.
if
But
he
that's how it
has
is,
the
that's how it is in
COVID,
restaurants, Kima.
but I'm just saying, if he has the COVID and he's grabbing the instruments and then putting them in the surgical area, now the instruments have the COVID.
No, because you decontaminate it. Like when you're washing
Yes.
dishes at a restaurant, you don't wear gloves.
Well,
Yeah, so just think like this. Just humble yourselves and think this is all new to me.
okay,
And
this
just
is
go
new to me. I'll let it go.
We're talking
I'll
about
let it go.
hundreds of years of research and all that good stuff. So
Okay.
decontamination is the physical or chemical processes that renders these inanimate objects safe for further handling. And that's one of the goals, is to make these items safe for further handling so they can be further reprocessed when you think about it, right? Somebody else has to touch this, has to interact with it, has to inspect it. So decontamination involves a thorough cleaning process that is accomplished with manual and or mechanical Cleaning. So working in the decontamination area where this technician is right now requires a thorough knowledge and understanding of microbiology. Well, they say a thorough. You need to have a very good awareness of microbiology, and basically how we kill microbes and pathogens, that kind of thing. Central service staff must be able to identify and clean a wide variety of medical devices. Here's a snapshot of part of a decontamination area in the sterile processing area. Remember, there are 3 functional areas to the department. The decontamination area is the collection point of all of the soiled items in the healthcare facility. Again, it requires a thorough knowledge and understanding of microbiology and the decontamination process. So all soiled instruments and equipment are received from departments in the decontamination area. Cleaning is the first step in the sterilization process. Cleaning is the most critically important step in the decontamination process. Items are considered contaminated and potentially infectious. All items that come into the decontamination area have to be considered contaminated and potentially infectious, which is why this technician is dressed the way that she is. She is all geared up in what we call PPE, personnel protective equipment. So anybody working in the decontamination area must be protected from the environment. Remember, we're in a hospital. People are sick. People are there because they're sick. People are there because they have all manner of who knows what. And patients may even have stuff that they didn't know they had, right? All of this stuff, or some of it, or a combination of it, could end up on the surgical instruments. And a lot of it could be communicable, right? You could catch it. We consider everything that we come into contact with in the decontamination area potentially hazardous to our health, which is why we wear the barrier that you see represented here in this picture. Personal protective equipment minimizes exposure to bloodborne pathogens and other contaminants. Anytime you see the term pathogens, we're talking about microbes that cause disease, right? The bad microbes, pathogens. We say bloodborne, it's in the blood, right? And in this case, on the instruments, potentially. So we wear fluid-resistant face masks, eye protection. We don't want anything splashing into our eyes when we are mouths, when we're cleaning this stuff. Fluid-resistant cover gowns, gloves. We need to be properly protected. So that's decontamination. Now we're in the preparation area. So decontaminated items, after they've gone through the cleaning process, the complete decontamination process, are inspected, assembled into what we call sets. They're packaged and labeled in the prep area. You see the machine behind the technician there? That is one of those industrial type cleaning machines. We call them washer decontaminators. These instruments have just gone through the process, so now he is able to handle them. So items are prepared for sterilization in the prep area. You guys still with me?
Still here.
Shalita back?
No.
Okay.
She was making faces. You could tell she used to be a class clown.
It was.
Central service technicians must be able to identify hundreds of surgical instruments. You're not going to learn them overnight. There's no requirement to learn them overnight. To become a certified technician, you don't have to know a whole bunch of instruments. It happens over time. There is an advanced course that I teach where we go into different instruments that are used in different types of surgeries, so on and so forth. But of course, you're taking care of instruments, so you're going to, at some point, need to be able to identify many, many different types of surgical instruments. Central service technicians must know how instruments are made, how to test them, and how to properly maintain them. Surgeons don't take care of their own instruments. We do it for them. We have to be able to inspect for cleanliness, and we have to be able to test the instruments for their proper function. When that instrument is put into the hands of a Harvard-trained brain surgeon, he doesn't want to worry about whether or not his scissors are sharp. They need to be sharp, and they need to be perfect every single time. Then there's packaging of these items prior to them being sterilized. Instruments and sets of instruments are packaged in special materials that provide a bacterial barrier after sterilization. So once we sterilize something, obviously we want to keep them sterile, right, until they're ready to be used. So there's special packaging protocols as well that we use to maintain the sterility of the surgical instruments. Packaging, again, this is happening on that prep side. Got the decontamination side, the machines are facing the clean side, the instruments come out once they've been decontaminated, and now all of this further reprocessing activities are happening in the prep and pack area. There are a variety of packaging materials, which we'll learn about throughout the course of this course. Sterilization. Sterilization is, and you need to know this definition, is the complete destruction of microscopic life. So what sterilization does is it completely destroys organic life as we know it. That is what sterilization is. So if there are any microorganisms present on these items after they have been decontaminated, the idea is that the sterilization process will in fact render these instruments free from anything that could cause an infection. And what causes infections, as you guys know, are pathogens, bad microorganisms, viruses, bacteria, fungus, so on and so forth. There are various kinds of sterilizers that we use to sterilize items. And then we have sterile storage. Again, sterile items are placed in carefully controlled storage areas until they are needed. Here's a quick snapshot of the reprocessing cycle. Where do we want to start here? Let's see. The instruments are clean. They're inspected. They're assembled. They're inspected. The point of this little graphic is we are inspecting all the way through the process, right? Instruments are used. They're returned to the decontamination area. They're identified. They're sorted. They're clean. They're assembled. And throughout this entire reprocessing cycle, we are constantly inspecting to ensure that the instruments are in good working condition and free of any contamination. Let's talk about some basic job knowledge and skills that are required to work in this area. You will require significant knowledge and skills to perform effectively on the job. Knowledge and skill sets should include the following. Communication skills. We're not going to spend too much time on that. The CS area is very dynamic. There's a lot happening. There's a lot changing. Communication skills are critically important. Being able to communicate what needs to happen and when it needs to happen, the urgency of what needs to happen is critically important. So obviously on the other end, listening is also going to be critically important, both oral and written communication. You need to be able to assess the ability of other people to understand what is being communicated, be able to adapt your communication style to individual needs. Again, this doesn't just apply to central services, it applies to every business, right? Applying active listening skills, using reflection, restatement, clarification, critically important when we're talking about what instruments are required, where, and when. We have to be able to interact appropriately and respectfully with diverse groups in numerous different types of situations. Communicate in a straightforward, understandable, accurate, and timely manner. And we have to be able to access and use electronically produced information. So you have to have some sort of basic computer skills, right? So employability skills. Again, this stuff works across all fields. Maintain appropriate personal skills such as attendance, time management, if you want to remain employed, and assuming responsibility for your own actions. Attaining professional conduct standards, using analytical skills to solve problems and to make decisions, formulate solutions to problems using critical thinking skills like Akima does every single day. We always have to be able to adapt to changing situations. Again, it's a very dynamic field and dynamic environment. Things are constantly changing. Room one in the operating room could be prepped to go with an open reduction, internal fixation of a fibula, but then a trauma case comes in. The patient's head has been crushed, and so that case needs to now be bumped. This other case is going to have to get started. So there are things constantly changing that we have to keep up with. It's a situation, it's an environment that has to be very, very closely managed. Everybody has to be doing their part. Engaging in continuous self-assessment and goal modification for personal and professional improvement. Exhibit respectful and empathetic behavior in all of our interactions with peers, supervisors, subordinates. Those soft skills that are critically important to getting along with people, right? Here's a nice snapshot of a central service department. Shamara, what part of the department would you think that this would be?
Is this the wait? I've taken.
Well, I'll give you some hints. Mm-hmm.
Okay.
I'll give you some.
Yes. Is it?
Well, we know it's not the dirty side, right?
Yeah. Okay. So this is where the central part is, where the clean stuff is.
Right. So, absolutely. So this is the prep side, the packaging side. So this is the clean side. You see no big machines, nobody wearing goggles and that kind of thing. So absolutely. This is the side where things are packaged and are getting ready to be distributed. Absolutely. Listen attentively to verbal instructions is critically important in this area. Request from your supervisor and other information, as it is in all other areas. Understanding various career options and the preparation required for them. The one thing that I will say about this particular field is that there is a career ladder and it goes way up. You could come in as an entry level technician without much experience and work your way all the way up to director, essentially managing a series of these kinds of departments in a hospital system. It's pretty wide open. It is pretty much up to you, but there is a career ladder. Technician, lead technician, supervisor, assistant manager, manager, director, regional director, so on and so forth. You do have some legal responsibilities, as you do in many jobs. We have to be able to solve problems relating to legal dilemmas or issues. We have to comply with established risk management factors and procedures, or we may be held liable for whatever is a result of us not following these procedures. We have to determine when an incident must be reported, and you're going to learn about all this fun stuff. And in the healthcare environment, confidentiality is critically important. You're going to be in a position to find out a whole lot about a whole lot of different people. And it's really, really important. It's actually against the law to talk about other people's health issues. I used to work for a hospital system in Southern California where, what's her name, was a patient. Blonde. She owned the 90s. Britney Spears.
Oh, okay.
Almost,
I
yeah.
thought you were going to say Paris Hilton.
Yeah. And there were actually some people who got fired from the hospital because they got into her information, shared information, that kind of stuff. So
that happened to Beyonce too.
Yeah. It's you know, I mean, you can go to jail for that. It's important that everyone operates within their required scope of practice. Just because you work in a hospital, you work in sterile processing, doesn't mean that you could be passing instruments during surgery or trying to fix broken equipment. Stay in your lane. Follow mandated standards for workplace safety, critically important, all of that OSHA stuff. Apply mandated standards for harassment, labor, and other kinds of employment laws. I mean, the legal responsibilities, again, really is across the board, no matter where you are, critically important. Ethics is something that is critically important everywhere. It's also important in healthcare. It relates to knowing the difference between right and wrong. As a healthcare professional, it means that you conform to accepted standards of conduct. It's a very professional environment, and ain't nobody trying to hear you talking to them any kind of way. That happens, but it's a very professional environment. You're not going to find doctors going at each other. It's just not going to happen, right? Not in that way. Same thing with nurses, same thing with professionals. We're all human and things happen, but it's a very professional environment. Everyone in the healthcare facility appreciates the seriousness of what the whole enterprise is about. So ethics should govern and guide the way central service technicians act and make decisions. We must always, all of this good stuff, right? Some of it common sense, respect the patient's rights, recognize the importance of the patient's needs over other considerations. It's all about the patient in a healthcare facility. Everything obviously is geared towards the patient's well-being. We want to be able to report any activity that adversely affects the health, safety or welfare of patients, visitors, or fellow workers. Exhibit loyalty to our fellow workers in the healthcare facility. Be able to differentiate between ethical and legal issues. Demonstrate professionalism when interacting with coworkers and customers. Yeah, my whatchamacallits are dancing. All right, we'll let them jiggle. All right.
Nice animations.
Sometimes they get away from me. Safety practices. The central supply, central sterile environment. There's a lot going on, a lot of equipment, a lot of heat. We use steam sterilization among other types. There's a lot of water that is used. There's a lot of heavy instruments. There's carts. Safety is critically important. Safety practices. Practice infection control procedures. Again, the whole idea whenever you hear infection control, or now the new term is infection prevention, the whole idea is to minimize cross-contamination, eliminate cross-contamination, eliminate the spread of infectious diseases within the healthcare environment. Again, it's an environment where people are already compromised, where their immune systems are not operating, at their fullest, at their best. So we take infection control very, very seriously, because obviously there could be seriously negative impacts on patients. So we use what are called standard precautions to control the spread of infection, and we'll get into that later on. We practice appropriate cleaning, disinfecting, and sterilizing processes. There's some very strict protocols on how all of this should be, is supposed to be conducted, and we need to follow it, or we're not decreasing the opportunities for disease to spread. Apply principles of body mechanics, including proper lifting techniques, a bunch of safety practices that we should be aware of. Recognize and correct fire and electrical hazards. Nobody wants a fire in a hospital. I've been there. Use instruments and equipment as directed. Manage hazardous materials appropriately. Use equipment as directed. Use safety data sheets, which we'll talk about later on, what safety data sheets are. Follow emergency procedures and protocols. Comply with pertinent regulatory guidelines, including OSHA standards. The point here is safety is critically important, and it's taken very, very seriously in the healthcare environment. Teamwork. Technicians must understand their roles and responsibilities of the individual members as a part of the healthcare team, including their ability to promote the delivery of quality healthcare. They must interact effectively and sensitively with all members of their team, and you do so when there was supposed to be another slide there. I wonder what happened to that. When we practice team membership skills such as cooperation, leadership, and anticipation of workers' needs. Being a good teammate, being a good, decent human being, and understanding that we're all pulling in the same direction for the same very important thing, and that's, the welfare of the patient. Respect diversity within their team, interact with others in a way consistent with the healthcare team structure and lines of authority. You can't be going to no doctor talking about, hey, what's up, homie? And, there's a hierarchy.
I couldn't do this job.
And there's a hierarchy where, That sort of thing needs to be followed. Manage conflict within the workplace by considering the points of view of others. That is a very interesting concept. Actually considering how other people feel. Very new to me. So we're going to respect diversity within the team, interact with others in a way consistent with the team, with the healthcare structure, manage conflict within the workplace by, again, considering the points of view of others. Accept compromise as necessary to ensure the best outcomes. But we only accept compromise when it doesn't compromise, the bottom line, the patient. Resource management. We use a lot of stuff to take care of our job, to do our jobs. Hospitals do an excellent job for the most part of taking care of patients, but it is a business. It's a business. CS technicians must understand and practice principles and techniques of resource management. Central service technicians manage resources effectively when you control cost and reduce waste as best as you can. Make sure you're opening the right thing. Make sure that you're being very careful and not wasting stuff. Provide quality service, practice time management skills, identify and solve potential problems, and anticipate the customer's needs. We want to make sure we know and understand our inventory and use them appropriately. Practice recycling and sustainability whenever possible. Resource management. Other skills, practice prescribed techniques to prevent healthcare-associated infections. Keep department work areas in good repair. There's one thing that you will notice when you walk into one of these departments, or you should, if I'm running it. Organization and cleanliness. Critically important to the well-functioning of one of these departments. So CS technicians are responsible for many different tasks. Job descriptions define and communicate the duties and our requirements. It's important to understand your job description. The job description is intended to be overviews that capture the general purpose and major accountabilities of a job, of your job. We won't get into that. We pretty much talked about this. Some states require certification. I know Florida doesn't. Most states don't require certification. Well, many states don't require certification, but they do require some form of training. Formal central service technology courses are available from a variety of sources. I'm one of those sources. Some hospitals are developing central service training programs. I have gone out and ran these programs for hospitals. Career growth and professional development depends on individual motivation. That is across the board. With increased knowledge, more responsibilities and opportunities will come. We talked about that career ladder and preparing yourself to move up within the field if that's something that you choose to do. Education and experience are critical to get ahead in today's dynamic and complex central service environment. Having the appropriate education and training, of course, is critically important. Qualified and educated professionals are in very high demand in the central service field. The central service environment is dynamic and fast-paced. The work is challenging, highly technical and complex. The performance of this vital department has a major impact on the successful operation of many departments to which it provides products and services. That's it for this week. Typically, we would want to cover 2 chapters, but I am not trying to kill nobody.
So that was only chapter 1?
That was chapter 1.
Okay.
And again, typically, when it comes to questions and stuff during the lectures, for my actual lectures, I usually tell people to hold their questions until the end of the lecture. But with our small group, I have no problems. But all that means is that we will probably run a little bit longer, which if you guys are okay with that, I'm okay with that. Now, this is completely up to you guys. We can move on with chapter 2, or we could just pick up chapter 2 next week. This was a lot of information.
Can we pick up chapter 2 next week?
Absolutely 100%. What you say, Melanie Clark?
Oh, Melanie Clark ain't here.
Melanie hasn't been here in years.
Oh, she's there. She's there. She's right here.
Yeah, I'm here. How
You've
come
been there the
I?
whole,
Yeah,
have you been there the whole time?
yeah.
Okay. What
You been there the whole time?
I have not
Next-
seen you the whole time.
Yeah.
Listen, no, she was. Here's what happened.
I haven't seen you guys.
But here's the thing. That's because they're not on camera. What happened was when I was doing the presentation, I wasn't looking at the screen I'm looking at right now. I'm seeing all of you. I was looking at my slides. So I didn't know that you were what we call on this program here, backstage, right? So if I knew you were, I would.
Yeah, because that's what it says, backstage.
Yeah, I would have clicked you back then. So that was my bad. Now let me end the broadcast so we ain't putting our business out